Hi, I'm Jason Seitz, and today I'll be giving you some basic instructions on how to self-inject your medication. We'll be covering two types of injection, subcutaneous or sub-Q injection, and intramuscular or IM injection. Discuss with your provider which of these techniques is needed for your medication administration. In this short video, we'll learn how medication is packaged and supplied, how to interpret dosing instructions, how to draw up the correct amount of medication safely, how to choose and prepare an injection site, how to self-administer subcutaneous and intramuscular medications, and how to properly dispose of needles and syringes. Before we get started, you'll want to ensure that you're comfortable with what medications you've been prescribed, how that medication is supplied and administered, how the medication works with your body to improve your health, and that you've had the opportunity to ask questions on these topics. Only when you've covered this information with an approved medical professional, including being informed of the side effects, potential adverse effects, and risks of administration, should you ever perform self-administration of a medication. This video is designed to be used in conjunction with written and verbal training from a medical professional. Consult with your healthcare provider for more information, and never be afraid to ask questions so that you can feel confident and safe with medication use. This training is not to be considered a medical order or approval or establish a relationship with a medical provider. Medication will typically be delivered to your home in a box, and oftentimes ice is included inside the box to keep the medications cooled. If the ice is melted, in many cases the medication is still safe to use, as it can be stable for several days inside its packaging. Check with your medical provider and packaging instructions to ensure that the medication is safe to use, unexpired, and to find instructions on how and where to store it. Your medication injection kits will typically contain a number of supplies, including the vial of product itself, directions, needles, syringes, and alcohol swabs. Additional material that you should have on hand includes spare alcohol swabs, an approved sharps container for needle disposal, and an ice pack if pain or swelling occurs after injection. Once these supplies have been collected, confirm that your medication is unexpired by checking the vial for an expiration date. Then, review how the medication is supplied. Let's quickly review these materials. The needle is attached to the top of the syringe and will be used to pierce the vial of medication as well as your skin so that you can deliver it. Needles vary in thickness and length depending on the area injected and how deep the injection should be. You will be provided with the appropriate needle for your injection type. Syringes are empty plastic containers with units of measurement in volume listed on their side. The top of the syringe connects to the appropriate needle, and the bottom contains a plunger to allow you to pull medication into and push medication out of the syringe. The vial of medication is typically a glass container with a capped top you can remove to access the vial with the needle and syringe. Medication vials are labeled as both solid dosage and liquid volume. The solid dosage refers to the amount of solid medication dissolved in a given volume of fluid. Milligrams and micrograms are examples of solid doses for medication. For instance, a doctor may prescribe 10 milligrams of a substance. The volume on a vial simply refers to the fluid that a medication is dissolved in. Milliliters and cc's are examples of a volume. On syringes, you're reading the demarcations for volume, not dosage. For instance, drawing up 10 milliliters into a syringe does not necessarily mean that 10 milligrams of a medication has been drawn up, unless the concentration of that medication is 1 milligram per 1 milliliter. This is referred to as concentration. The vial will also list its total volume, for instance, 10 milliliters. Let's take a look at an example. If the doctor has ordered 10 milligrams of a medication, and you have a 1 milligram per ml vial of medication, that means that for every milliliter drawn up, 1 milligram of the medication is drawn up as well. So you'll draw up 10 milliliters to assure you have 10 milligrams of the medication in your syringe. However, if the same dose is ordered, but you're supplied with a 2 milligram per ml vial of medication, then for every milliliter drawn up, double the milligrams are in your syringe. So you'll only have to draw up and administer 5 mLs, but achieve the same dose of 10 milligrams. The second example is an example of a higher concentration of medication in the vial. Often, very small insulin syringes are used for self-administration. Insulin syringes are measured in units, where each represent 1/100th of a milliliter. So for instance, if your dosage is 0.3 mLs, you would give 30 units. Now, don't panic if you aren't a mathematician and this confuses you. The good news is that you should be provided with both the solid dose and the subsequent volume you should draw up in your specific syringe for the concentration of the med that you've been given. For instance, your instructions should provide something like this. This instructs you to draw up and deliver yourself 1 milliliter of semaglutide for the correct 1 milligram dose. This instructs you to draw up and deliver yourself 0.25 milligrams of semaglutide, which is 25 units on the syringe you're provided. Subcutaneous injection is an injection into the top layer of fat just below the skin or dermis. The needle will puncture through the skin layer and inject product into this fat layer, where it will be absorbed into the surrounding tissue and introduced to the bloodstream. For subcutaneous injection, choose one of the following sites: the abdomen, the back of the upper arm, or the outer thigh. Intramuscular injection is an injection with a longer needle through the skin and subcutaneous layer of fat into the muscle tissue, where it will absorb into the bloodstream from there. The only significant difference is a slight change in injection technique and your length of needle. Injection sites for IM injections include the deltoid muscle in the upper arm, the vastus lateralis muscle in the middle third of the thigh, the ventrogluteal muscle in the hip, and the dorsogluteal muscle in the buttocks. Be sure to review the area of injection and its identifying factors to ensure that you don't inject near any nerves, large blood vessels, or bones. Sites should always be free from injury, skin lesions, abscesses, or abrasions. Prior to any injection, gather your supplies. If your medication was stored in the refrigerator per its storage instructions, ensure that it has been removed and is now room temperature before administering. Once these supplies have been collected, confirm that your medication is unexpired by checking the vial for an expiration date. Then, review how the medication is supplied. Be sure to wash your hands thoroughly using soap and water. Remove the cap on the medication vial and, using an alcohol swab, clean and sterilize the top of the vial where you'll be inserting the needle. Then, using another swab, clean and sterilize the site you will be injecting. Next, attach the needle to the syringe if needed and remove any caps on the syringe, needle, and plunger, exposing the needle. Pull the plunger back to the amount of medication needed, drawing air into the syringe. Turn the vial upside down and insert the needle through the rubber cap of the vial. Push the air into the vial and gently release pressure on the plunger and pull until the correct amount of medication is in the syringe. Remove the needle from the vial. Check the syringe for air bubbles, and if present, gently flick the syringe until all air bubbles are gone. Introduce the needle to the cleansed skin site at a 90-degree angle. If performing a subcutaneous injection, pinch the fold of skin you're injecting into. If your injection is intramuscular, gently pull on the skin with your non-dominant hand and inject. Fully insert the needle and slowly push the plunger to deliver medication. Wait 2 to 3 seconds, then remove the needle in a straight line motion. Immediately dispose of the needle into an approved sharps container. Never reuse needles. Dispose of them in the trash or leave them uncapped or accessible. You can find more information on safe needle disposal as well as regulations for your specific area at safeneedledisposal.org. Do not massage the site of injection as it can interrupt the medication's absorption. If approved by your provider, ice can be applied to the site to reduce any swelling or pain. And that's how to self-inject medications. We've learned how medication is packaged and supplied, how to interpret dosing instructions, how to draw up the correct amount of medication safely, how to choose and prepare an injection site, how to self-administer subcutaneous and intramuscular medications, and how to properly dispose of needles and syringes. As always, consult with your medical provider for any questions or concerns you may have, and request additional education materials when needed. We hope you've enjoyed our presentation. Stay safe and stay healthy.